Good morning, everyone. I'm Dr. Vishnu Gade, consultant neuropsychiatrist at Areet Hospitals, Gachibowli, Hyderabad. So today I wanted to talk to you about depression and what are the causes, what are the signs and symptoms, and what are the treatment options available for depression. Now, a lot of people get confused with sadness and depression. So sadness is a temporary phase of low moods or feeling dull, which can affect anyone at any age due to multiple reasons. It can be low performance in school by a school kid. Maybe he didn't perform well in class, or maybe he was supposed to do homework which he didn't finish due to the difficulty level that it had, and the teacher had scolded him. Or it might be a software employee who did not meet his task deadline, and the manager had to reprimand him for certain reasons. And all these things can cause a person, he or she, to be upset for a temporary period of time, but how he bounces back, how he addresses the situation, and what he does to act on it can bring him out of that mood phase, which is low mood, sadness, or frustration, irritability. So depression is now a mental health condition. An interesting statistic shows that 1 in every 5 people in the world have suffered from depression once in their lifetime. Now, the degree of depression, the severity may vary. So we classify it as mild, moderate, severe, and so based on that, we classify and grade the patients who come to us. We use various diagnostic tools. We have a criteria given by the World Health Organization and the DSM-5 by the American Psychiatric Society, and based on that and the clinical examination by the psychiatrist in the hospital, we come to a diagnosis, and we can assess what degree of depression the patient is suffering with. So depression is a mental health condition. It's a mental health disorder. So it is basically caused by imbalance in the neurotransmitters in the brain, such as serotonin, norepinephrine, and dopamine. So depression is characterized by low mood, low energy levels in the person to do in the basic small tasks which he used to do, decrease in interest in performing those tasks. Then next comes, there'll be a decrease in the sleep cycle. The patient may sleep very less, the circadian rhythm is affected, the appetite is affected, he might eat very less, there might be weight loss. Also, concentration is affected, focus and performance in daily activities and task completions are affected. There might be suicidal ideation by the patient, and that is a very, very serious mental health risk. And then confidence, low self-esteem, optimistic views of the future are decreased, so the person is more on the pessimistic side, and these are one of the few symptoms and signs seen in the depression patient.